The top stories tonight in Y News. Metro Manila will remain under general community quarantine or GCQ starting tomorrow, August 1st until August 15th.
President Rodrigo Duterte expresses confidence the Philippines will be back to normal once a COVID-19 vaccine is available by December 2020.
There is no definite date yet when a COVID-19 vaccine will be available, the country's health department says, while the tagging of COVID-19 recoveries is symptoms-based and not taste-based anymore.
Some senators expressed doubt over the mass recovery adjustment of the country's health department.
The World Health Organization urges young people to avoid crowded places like nightclubs.
And confirmed cases of coronavirus infections in Australia exceed 10,000 today.
Good evening, Philippines and the world. Today is Friday, July 31, 2020. Join us in the next hour as we deliver today's top stories around the globe. I am Harleen Delgado.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I'm Angelo Castro III.
First in the news, Metro Manila will remain under general community quarantine or GCQ starting tomorrow, August 1st until 15th, 2020. This is despite being the region to report the most new cases in previous days. Joining us tonight is our Malacanang correspondent Rosalie Cos to tell us why live. Yes, Rosalie.
Harleen, the Interagency Task Force Against COVID-19 has approved the recommendation of the IATF Screening and Validation Committee on the Community Quarantine Classification in parts of the country. The community quarantine measures, which are either extended or downgraded, are based on epidemic risk level, economic, social, and security considerations, as well as on appeals and commitment of local government units. President Rodrigo Duterte has announced that Metro Manila will remain under general community quarantine starting tomorrow, August 1. This is despite the severe community transmission of the coronavirus disease in the National Capital Region. In Luzon, aside from Metro Manila, GCQ will also be implemented in Bulacan, Batangas, Cavite, Laguna, and Rizal. In the Visayas, the cities of Cebu, Lapu-Lapu, Mandaue, and Talisay, and the municipalities of Minglanilla and Consolacion, all of those are in Cebu Province. And in Mindanao, only Zamboanga City is under GCQ for the next 15 days, while the rest of the country will be under modified general community quarantine. Although restrictions in some parts of the country are now more relaxed, President Rodrigo Duterte has a reminder.
Na Philippines okay na. Ito yung modified general community. Kunting ingat lang, do not mix together and observe itong distancing, the distance rule. Yan lang hihingi ko sa inyo.
Rosalie, just to clarify, does the new quarantine classifications come with new orders or mandates from the IATF, or are these different from previous ones?
Yes, Harley, in the local governments in the 16 cities in Metro Manila, including Pateros and in Region 4A, are mandated to enforce strict localized lockdown or enhanced community quarantine in barangays where 80% of cases are located, and the names of those barangays will be published. Minimum public health standards should be enforced, as well as massive targeted testing, intensified tracing, quarantine of close contacts, isolation of confirmed cases, and off-plan kalinga. Mandatory wearing of face shields is also recommended in the NCR and in Calabarzon. Government hospitals in those two regions are directed to increase their hospital beds dedicated to COVID-19 up to 30 to 50% while private hospitals are enjoined to increase their hospital beds dedicated to COVID-19 up to 20 to 30%. National Task Force treatments are held under Secretary Leopoldo Vega will monitor the compliance of the hospitals in these areas. Also, local government units are directed to submit daily and weekly updates on the daily trend of active COVID-19 cases, cases in community isolation facilities and health facilities, and in homes.
Rosalie, our president also mentioned that the country will be back to normal once COVID-19 vaccine is available by December this year. Rosalie, why did he express confidence about this?
Well, Harleen, even before, Malacanang has been saying that China will prioritize the Philippines once its anti-COVID-19 vaccine becomes available. But President Duterte made this assurance again in his televised public address this morning. China has several pharmaceutical companies where advanced stages in developing potential COVID-19 vaccines are in the works.
I could not have uttered a single sentence about roadmap to recovery. Kasi ang una talaga dyan, ang medicine. Now, sa mayroon na, except for the authorization, yung i-distribute na, at yung final approval, distribute na sa mga opisina niya dito, Pfizer, Moderna, for the public. I promise you, by the grace of God, I hope by December, we would be back to normal. Huwag ninyo yung new normal. Kasi sabi ko nga noon, pag-umpisa natin, hintayin lang natin yung vaccine. Hintayin lang ho ninyo by December.
Once available, the government will distribute the vaccine for free to poor families, the sick, policemen, soldiers, and middle-income households. The chief executive wants the military to take charge of the government's coronavirus immunization program. Here's the statement of the chief executive.
Ito ang i-guarantee ko. Ang listahan ng mga tao na makatanggap ng pera noon sa hirap, ang una, ang nagbibigyan ng assistance, yun ang kategory natin. Ang mauna, yung walang-wala. At saka, of course, those on the mga hospitals. Yung mga sick na or dying. Ang una talaga yung mga tao sa listahan na tumatanggap ng assistance sa gobyerno. Ngayon, pangalawa, yung middle income. Libre to, hindi ko ito pagbili.
The president also mentioned about giving vaccine even to communist rebels if they will stop fighting until December 2020. However, drug pushers and drug addicts will not be able to avail of COVID-19 treatment, he said. On the other hand, a public health expert says that COVID-19 will stay even if with the availability of vaccines against the disease.
So kahit po may bakuna, hindi po siya 100% guarantee na mawawala na po ang COVID. Makakatulong po siya. Pero hindi ho natin pwedeng i-relax ang ating measures na ating binibigay o ginagawa para maiwasan ng COVID.
Harleen, also in his public address, President repeated his statement about using gas as disinfectant against the coronavirus disease if there is no rubbing alcohol available. According to the chief executive, he is not joking.
Pag walang alcohol available, hindi ka naman pwede, lalo na mahirap. Magpunta ka lang dyan sa gasoline station niya pagkatapos na magpatulo ng that's disinfectant, alcohol, gas, yung ginagamit yung gas pang magpatulo ka lang just to disinfect. Ang akala naman itong mga buang na nagsabi sa akin, para sa inyo ang hindi nakakaintindi, sa totoo lang, hindi ako nagbibiro. Totohanan yun. Akala ninyo nagbibiro lang ako.
But this is contrary to an earlier statement of presidential spokesperson Harry Roque that the chief executive statement about gasoline as disinfectant was merely a joke. Here's the statement of Secretary Roque.
Kayo naman, 4 na taon sa presidente, parang hindi nyo pakilala sa presidente. Joke only. Bakit naman tayo maghuhugas ng gasolina, no?
According to the Department of Health, alcohol is still better to use if water and soap are not available. Here's the statement of Health Undersecretary Rosario Vergere.
Inirekomenda po ng DOH at FDA na gumamit po ng alcohol or alcohol-based hand sanitizer. Ang mga alcohol po dapat ay naglalaman ng 70% ethyl alcohol or isopropyl alcohol, samantalang ang alcohol-based hand sanitizers ay dapat po naglalaman ng 60% ethyl alcohol or isopropyl alcohol.
When asked again about the issue, presidential spokesperson Roque explained the chief executive said gas or anything that would kill germs. Harleen?
All right, thank you so much, Rosalie Cos, for that report.
The poorest of the poor in the Philippines need not worry about COVID-19 vaccine because they can avail of it once it becomes available in the country. Johanna tells us why.
Should a COVID-19 vaccine become available by December, the Philippine government assures there will be funding for vaccine procurement. Finance Secretary Sonny Dominguez discussed that the government plans to ask for a loan from financing institutions to fund the purchase of COVID-19 vaccines. The government targets to provide free vaccines to around 20 million Filipinos in the poorest of the poor sector. Each individual will be given 2 shots of vaccine, so the government needs around a 20 billion peso funding. The Philippine International Trading Corporation under the Department of Industry will be in charge of negotiating the loans with financial institutions.
Hindi po kailangan magbenta ng property, kaya po ipinapadaan sa PITC, Philippine International Trading Corporation, dahil para po dito sila po ang in effect directly manghihiram mula sa DBP and Land Bank. So DBP and Land Bank, yung sinasabi ni Secretary Dominguez, ang may pondo na magpapahiram dito po sa isang government corporation who will execute the importation or the buying ng mga vaccines dito. At para po ang PITC ang magsusupply sa DOH.
Payment for the loans, which will be payable in 2 or 3 years, will come from the Health Department's budget.
So once that happens, the Department of Health now will put in their budget to pay this $400 million or roughly 20 billion pesos. And we can pay that over maybe 2 or 3 years. So babayaran na lang nila to the financing company, which is Land Bank and DBP. So kayang-kaya ho ng DBP at saka Land Bank i-finance itong purchase ng COVID virus.
According to the DTI, the target 20 million Filipinos to get anti-COVID-19 shots is just initial, but this number may increase depending on the recommendation of the DOH. The private sector may also file a loan through the Philippine International Trade Corporation or PITC if they want to procure COVID-19 vaccine, according to Secretary Lopez.
Maring initial po yon dun sa poorest of the poor na communities. At of course, beyond that, ang private sector naman ho, pwede ring makibili, padaanin din dito sa PITC para makakuha tayo ng volume purchasing, volume discount pagka ipinadaan sa PITC itong mga requirements pa ng mga ibang pribadong sektor. Para beyond the 20 million ay mabakunahan din.
The DOH will recommend the brand of COVID-19 vaccine the government will procure. Joanna, UNTV News and Rescue. We serve the people, we give glory to God.
A public health expert recommends to maintain the implementation of health protocols even when a COVID-19 vaccine is available. Meanwhile, a lawmaker says that passengers may need to wear PPEs when commuting. One of our senior correspondents, Ray Palayo, will tell us why.
The House Committee on Transportation Chair sees the need to increase the allowed capacity of public transportation already allowed to operate, such as trains and buses. For Representative Edgar Sarmiento, this is possible if commuters will be required to wear face shields and personal protective equipment to avoid or minimize getting infected by the coronavirus. This is the objective of House Resolution 1038 the lawmaker has filed in the House of Representatives. The resolution also cites the study made by the National Institute for Occupational Safety and Health that wearing face shields will reduce 96% of exposure and 97% of contamination.
We will be increasing sana the capacity of the rails, capacity of the buses. Pero ang pasahero po, kung naka-shield, may maskara po, not only 50%, we can increase it farther, no? Tapos hindi lang sila nagkakaharap, nagtatalikod lang sila.
However, University of the Philippines College of Public Health Dean Vicente Belisario says there is no guarantee of full protection from the virus upon wearing PPE. He adds that there is no concrete study that could back the efficacy of using a barrier on motorcycles for rider and his backrider.
Or we propose here, kulang pa po ang ebidensya, maaaring gumawa ng pag-aaral para ma-establish kung ano na itulong ni barrier or shield. Pero theoretically, it should add to the layers of protection.
Belisario notes that the concrete efforts of passengers and drivers in reminding each other to observe the health protocols would help limit the spread of the virus. Ray Pelayo, UNTV News and Rescue, we serve the people, we give glory to God.
Every age group should take the necessary precautions to protect themselves and other people around them from being infected with COVID-19. This is what the Director General of the World Health Organization stated during a routine media briefing on Thursday. WHO Director General Tedros Adhanom Ghebreyesus also acknowledged that long-term care facilities are being hit hard by the coronavirus in many countries. He also stated that although seniors are vulnerable to COVID-19, young people face the same risk of being infected. He said that in some countries, there has been a mounting of cases because young people relaxed their vigilance and didn't follow precautionary measures.
Young people are not invincible. Young people can be infected. Young people can die. And young people can transmit the virus to others. That's why young people must take the same precautions to protect themselves and protect others as everyone else.
The World Health Organization not only warns young people of the same risk of getting infected with COVID-19 as older people, but also advises them of what each of the youth can do and consider when deciding where to go or what to do to protect themselves and other people from the virus.
So maybe you are healthy and you are young, but you may pass it on to somebody who you live with, who may be more vulnerable, who may be in an older age group. You can avoid crowded places. You can wear a mask if you're being asked to wear a mask, especially if you cannot do physical distancing. You can practice hand hygiene. You can practice respiratory etiquette and physical distancing at all times. You could avoid those crowded places in those nightclubs.
Let's now take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of over 17.3 billion confirmed cases in 188 countries, regions, and sovereignty. Of the global tally, countries in the Americas have so far reported a total of almost 9 million confirmed COVID-19 cases. And according to the World Health Organization, they still consider Central and South America to be an epicenter of transmission.
The situation in Central and in South America and Latin America in general is, as you see from the figures, is mixed. Many countries still have very, very intense community transmission. The number and rates of cases and deaths is still rising across large areas in Central and South America. So from Mexico all the way down to Argentina, we still see a very difficult and challenging situation. From the perspective of WHO, we still consider Central and South America to be an epicenter of transmission, and much work is still to be done in terms of both suppressing transmission and reducing exposure at the community level.
Global death toll from the fast-spreading disease has surpassed 673,000. That's after almost 6,000 deaths around the world caused by the new coronavirus were recorded in the last 24 hours. On the other hand, more than 10.1 million patients across the globe have recovered from the new coronavirus infection. Thanks be to God. Meanwhile, the country's Department of Health says that 4,063 new cases were reported today based on tests done by 74 out of 91 laboratories. That raises the total confirmed cases of coronavirus infection in the Philippines to 93,354. The highest number of new cases were recorded in the National Capital Region with more than 2,000, followed by Cebu with over 600. As of July 30, more than 1.3 million individuals in the Philippines have been tested for COVID-19. We have lost 40 more patients to the disease. But through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 165 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 65,178. Thanks be to God. If the Department of Health is asked when will there be an available vaccine against COVID-19 for Filipinos, its officials will say there is no definite time as of the moment. What the DOH assures is that the Philippines will be among the priorities to avail of a COVID-19 vaccine. Aiko Miguel tells us why.
The Philippines is one of the countries participating in the Gavi COVID-19 Vaccines Global Access or COVAX facility launched by the World Health Organization. This is to assure that Filipinos will have access to COVID-19 vaccine. COVAX facility is a part of the COVID-19 Tools or ACT Accelerator. This is a global collaboration for a faster development and distribution of COVID-19 vaccines, tests, and treatment. According to the country's Department of Health and Food and Drug Administration, there is a long process for finding a cure and vaccine against COVID-19. But because the Philippines is participating in the initiative, the country will be among those to be prioritized to have access to the vaccine.
Itong COVAX facility na ito, merong mga arrangements ang ating country with them. So, ang negotiations na yan, basta pumasok ka dyan, meron ka syempreng mga kailangan din na contribution for that, but definitely ang bawat country will be assured of 20% of their population na maaring mabigyan.
Although there are existing regulatory processes in other countries like the USA and China, the Philippine FDA's regulatory process will be followed once a vaccine is available.
Wala pang final agreements dito, Aiko, inaayos pa lang natin, and we are trying very hard na makaposisyon tayo dyan because that would benefit really the country. Dahil pag dumating ang mga bakuna, we will be assured of this number of vaccines.
There are 150 countries who are part of the global facility, which aims to deliver 2 billion doses of safe and effective vaccine to be approved by the end of 2021. This is why the DOH says it is still uncertain if a COVID-19 vaccine will be available this December.
Pinag-aaralan natin ngayon, especially yung target, sino ba yung mauuna kung sakaling iyan lang ang makukuha natin. Pero hindi lang naman yan ang kausap natin.
Aside from the COVAX facility, there are also 4 vaccine manufacturers which the DOH is on talks to be one of the country recipients of COVID-19 vaccine, 3 of which are in China and 1 is in Chinese Taipei. Although candidate vaccines run through clinical trial phases and tested for efficacy in humans which take months to years, the DOH is also hoping for a cure for COVID-19 to help protect the public and to be made available in the market for those who are capable of purchasing vaccines. Aiko Miguel, UNTV News and Rescue. We serve the people. We give glory to God.
Navotas City Mayor Toby Tiangco is dismayed with what city authorities observed among residents amid the citywide lockdown. Dante Amento tells us why.
Several Navotas City residents still continue to go and move outdoors even without any valid reasons, despite the implementation of a lockdown. And now, after the 14-day citywide lockdown, Navotas City Mayor Toby Tiangco laments over the lack of disciplines of residents who choose to go outside their homes despite the stay-at-home order. Children could be seen playing outside their homes without a face mask on. Based on a report from the City Police Office, the number of community lockdown violators in the city is over 6,000. Violations include not wearing a face mask, not observing physical distancing, and moving around the community without a quarantine pass. For now, barangay officials continue their operations against violators who may face a penalty such as a fine of 250 pesos or 3,000 pesos depending on the kind and number of violations.
Right after nung ma-lift yung lockdown, para doon nakawala sa hawla yung mga tao. Pero ang ginagawa naman po naming barangay, continuous monitoring pa rin po.
Meanwhile, the free swab testing in the city, which began on July 23, concluded today.
Pero po may plano po na i-extend ito hanggang August 12 po. Sa ngayon po, meron na po tayong total ng 4,683 na na-swab.
As of yesterday, Navotas City has more than 1,800 COVID-19 positive cases, 905 active cases, 900 recoveries, and 93 death cases linked to COVID-19. Damtiamento, UNTV, News and Rescue. We serve the people. We give glory to God.
Not only ordinary citizens, healthcare workers, and frontliners get infected with the coronavirus disease. There are also some famous personalities who have tested positive for the dreaded disease. Get to know some of them as Vincent Arboleda reports.
The coronavirus disease 2019 spares no one, whether the rich or the poor, ordinary citizens or famous personalities. Anyone can be infected by the dreaded disease. Among the famous personalities who got infected with COVID-19 is Hollywood actor Tom Hanks. On March 11, Hanks posted on his Twitter account saying he and his wife got infected with COVID-19. Game of Thrones star Christopher Hivju also tested positive based on his Twitter post on March 16. While singer Pink posted on her Instagram account her coronavirus diagnosis, saying she and her son visited their doctor after experiencing COVID-19 symptoms. The famous author of the Harry Potter books, J.K. Rowling, was also reported to have contracted the virus but has recovered thankfully. Despite having healthy physique, athletes were not spared by the COVID-19 pandemic. As NBA two-time most valuable player Kevin Durant also tested positive for COVID-19. Blaise Matuidi, who won the World Cup with the French national team Juventus in 2018, also tested positive for COVID-19 on March 27, as well as tennis player Novak Djokovic, the world #1 in men's single tennis. Several politicians have also been found positive for COVID-19. United Kingdom Prime Minister Boris Johnson and Jair Bolsonaro, Brazil's president, have been infected by the virus. Even the royals are not immune from COVID-19. The eldest son of Queen Elizabeth II, Prince Charles, also contracted the virus, as a spokesperson of the Prince of Wales stated on March 25. Another royal, Prince Albert II of Monaco, became the second royal and the first head of state to be found COVID-19 positive, while Maria Teresa, the Spanish Princess of Bourbon-Parma, became the first royal to die from COVID-19 at the age of 86. In the Philippines, several personalities also got infected with SARS-CoV-2, the virus that is responsible for COVID-19. These include Senator Sonny Angara, Senator Miguel Zubiri, and Senator Coco Pimentel. The President's cabinet members, DILG Secretary Eduardo Año, Education Secretary Leonor Briones, as well as DPWH Secretary Mark Villar, were also forced to quarantine themselves for a time after being infected. Quezon City Mayor Joy Belmonte also tested positive and had just recently recovered, while former COMELEC Chairman Sixto Brillantes is currently in critical condition. These are just some of the famous personalities in different parts of the world that have been infected with COVID-19, proving that the disease spares no one. With the growing number of COVID-19 positive patients in the country, authorities advise the public to follow the minimum health and safety protocols such as wearing of face masks, frequent washing of hands, and maintain physical distancing. National Task Force Deputy Chief Implementer and Testing Czar Vince Dizon cited reports from the World Health Organization that following these health protocols could significantly decrease the chance of getting infected with COVID-19. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
The country's health officials explain they have been using global standards as basis to tag or declare COVID-19 patients as recoveries. The DOH also clarifies that a person who is asymptomatic and has completed a 14-day quarantine or has clinically recovered is no longer infectious. Aiko Miguel will tell us why.
The number of COVID-19 recoveries in the country yesterday, July 30, 2020, mounted to more than 38,000. Because of this, the total COVID-19 survivors in the country reached over 65,000. More than 3,000 confirmed cases were recorded yesterday, which is why COVID-19 cases piled up to almost 90,000. According to the DOH, it seemed there has been a mass recovery because mild and asymptomatic cases who completed 14 days of isolation and no longer manifest symptoms are already tagged as recovered. They should be given a clinical clearance by physicians. The policy the DOH used in this is based on global standards. The reporting is symptoms-based instead of test-based.
Even around the globe, no? Wala naman tayong naririnig na pumuputok na balita na yung mga tinag nila as recovered, as we are now going to do, nagkakalat ng infection sa community. So ito talaga ay talagang appropriate surveillance lang, ensuring that minimum health standards are there.
According to the DOH, based on scientific evidence, a clinically recovered patient no longer showing symptoms after 14 days of infection and completed isolation period is not infectious anymore.
And after that, the patient can already be reintegrated in the community, whether magtatrabaho na siya or whether nandun lang siya sa komunidad. Pero hindi na po natin siya kailangan layuan kasi ayon sa mga scientific evidence, hindi na po siya infectious.
The DOH also added, individuals with a viral load or with symptoms are still infectious.
Pagka asymptomatic po siya, after 14 days without symptoms, you can already tag as recovered. Pwede na po siyang magtrabaho. Kapag po naman ito ay may simptomas siya nag-umpisa, ang importante na titignan natin, meron pong diagnosis or may assessment ng ating physician na sinabi clinically recovered ka na at saka nakakompleto siya ng 14 na araw na isolation from the date of onset of illness.
According to the DOH, the mounting of positive cases and recovery rate is due to the reconciliation efforts of the DOH and local governments under Upland Recovery. This is a DOH initiative to monitor the status of confirmed COVID-19 cases in the Philippines. The DOH reminds the public to listen to experts' update and advise to avoid getting infected with COVID-19.
We have to believe the experts. Kung hindi tayo maniniwala dyan sa mga eksperto na yan, saan pa tayo maniniwala? So even these people who have been tagged as recovered, pag lumabas yan sa community, kailangan naka-mask yan, nag-physical distancing, nag-uugas ng kamay madalas. So ito yung safeguard natin.
Aiko Miguel, UNTV, News and Rescue. We serve the people. We give glory to God.
Some senators have raised concerns over the recent mass recovery reporting of the Department of Health. This comes after 38,000 new recoveries were reported yesterday, the highest recorded number of recoveries reported in a single day after patients with either mild or no symptoms are tagged as recovered 14 days from the date of onset of symptoms or by date of specimen collection. Senator Risa Hontiveros says the recent changes in the reporting system of the DOH is doubtful and creates confusion among the public. According to the lady senator, the health department needs to fix its communication with the public, noting that clear communication is what will earn the people's trust. Meanwhile, Senator Joel Villanueva believes this only shows that there's a problem with data interpretation. In a tweet, the senator says such reporting gives people a false sense of security. He adds the department's reporting style is much worse than the unpredictable weather. Senator Kiko Pangilinan, for his part, wonders if a miracle or magic happened because of the spike in numbers. According to the opposition senator, more people might get infected if COVID-19 patients are tagged as recovered without undergoing confirmatory tests. Meanwhile, Senator Amy Marcos says the DOH data is utterly irresponsible. However, for Senator Sonny Angara, the trend of the DOH data should be observed first in the next few days before rushing to judgment based on one-day results, noting that the adjustment made by the department was based on an international protocol. But former Senator and now Sorsogon Governor Cheese Escudero says the mass recovery adjustment and the high number of new cases was only in the Philippines. He also described it as intolerable and insulting. The former lawmaker further calls on the president to fire Health Secretary Francisco Duque III, saying that he and the people deserve better. In response, Health Undersecretary Maria Rosario Vergere maintains that the recent recovery protocols are based on current evidence followed by other countries. Vergere explains mild and asymptomatic patients are no longer infectious on the 11th day, and that the PCR testing must only be used to test for infection and not for recovery. The health official adds the mass recovery date adjustment was not based on mere interpretation of data, but in the application of evolving scientific evidence.
Building cell towers will address issues in the telecommunications service in the country, according to a former government official. But the processing of permits with local government units hampers the construction of telco towers. Asher Kadapan Jr. tells us why.
Former Information and Communications Technology Acting Secretary Eliseo Rio Jr. explains that having an adequate number of cell towers for telecommunications provides better service to subscribers. He cites Vietnam with a little less population than the Philippines but has thrice the number of cell towers our country has, reaching about 70,000 compared to just about 20,000 telco towers in the Philippines.
Kulang ang cell site. Ang nag-share na isang cell site natin is 4,000. No, ang ideal para walang ganong drop call is less than 1,000. Eh kung 4,000 tayo natapan, sigurado may mga drop calls na ma-experience yun, no?
In a meeting with President Rodrigo Duterte in Malacanang last night, Globe Telecom Chief Executive Officer Ernest Koo explains that the delays in the construction of cell towers were mainly due to the process of acquiring permits for every cell tower from concerned local government units and national agencies.
We are suffering from many years of this. Before your administration, many administrations, no? 25 to 29 permits, umabot ng 8 buwan. Tapos marami pa kung kaming mga miscellaneous fees ho, iba-ibang klaseng tower fee. Meron kaming special use permit.
Rio attests to such concerns of telcos against LGUs.
Ito ang number one problem. Ginawa rin ng income generating ng mga LGUs ang mga telcos na. So sa permit, siyempre may babayaran ka dyan, legally or illegally.
President Duterte is dismayed with the process and urges telcos to directly report to the Duterte administration any incident of irregularity in processing documents.
Isumbong na lang ninyo diretso. At ang order ko sa cabinet ngayon is to really take yung pinakamabigat, the most drastic measure that you can find para magkaintindihan na tayo. This is my last mile.
Secretary of the Interior and Local Government Eduardo Año, however, assures they have already eliminated most of the procedures in securing a permit and have also made the process faster.
Dati po, kailangan pa ng Homeowners Association na resolution. Kailangan pa ng Sangguniang Bayan resolution. Wala na po yun. 16 days to 20 days po ang target para yung lahat ng permit ay tatakbo.
Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Jego, we're on board the UNTV radio mobile booth and we are here in Commonwealth Avenue in Batasan Hills, Quezon City. Let's take a look at the situation on the road. For motorists coming from Elliptical Road going to Fairview, expect a light to a moderate traffic ahead in this area of Commonwealth Avenue. Meanwhile, on the other side of the road, we have a light traffic for vehicles coming from Fairview going to Elliptical Road and going to EDSA. Just a simple reminder to our drivers, we have a slippery road tonight due to light to moderate rains that we are experiencing, so take extra caution while on the road. And for our weather update. The low-pressure area outside the Philippine area of responsibility has intensified into a tropical depression. State Weather Bureau Pagasa says as of 2 p.m. today, the LPA was spotted 1,005 kilometers west of northern Luzon, moving west towards southern China and northern Vietnam area at 20 kilometers per hour. It has maximum winds of 55 kilometers per hour near the center, gustiness of up to 70 kilometers per hour. The tropical depression has no direct impact over the country. However, it continues to enhance the southwest monsoon that is affecting the country. This will bring monsoon rains over Pangasinan, Zambales, Bataan, Palawan, including Calamian and Cuyo Islands, Aurora, Isabela, and Mindoro provinces. Meanwhile, cloudy skies with scattered rains and thunderstorms will prevail over Metro Manila, Visayas, Caraga, Northern Mindanao, Zamboanga Peninsula, Sulu, Basilan, Tawi-Tawi, and the rest of Luzon, while the rest of Mindanao will experience partly cloudy to cloudy skies with isolated rain showers or thunderstorms. On the other hand, a new low-pressure area has been spotted off the coast of Cagayan. As of 3 p.m. today, the LPA was located at 875 kilometers east of Tuguegarao City in Cagayan. Pagasa says it has no direct impact over the country as of the moment, but they will continue to monitor the LPA as it may intensify into a tropical depression.
And for the news abroad, here's Marielle Latoza live from Perth, Australia. Marielle, what have you got for us tonight?
Diego, for the whole month of July, the state of Victoria here in Australia was able to report only 4 days of less than 100 daily new cases. Also, the First Lady of Brazil has tested positive for SARS-CoV-2. I will also tell you why the Tokyo governor says the Japanese capital could issue its own state of emergency.
Go ahead, Marielle, tell us why.
For the whole month of July, the state of Victoria here in Australia was able to report only 4 days of less than 100 daily new cases. The highest recorded was 723 cases on Thursday, along with 13 reported deaths. At least 150 healthcare workers are infected and have been working in different nursing homes while infectious. 1 out of 4 Victorians who were supposed to be in self-isolation were missing from their home when Australia Border Force personnel came knocking at their doors, and 100 incidents were referred to Victoria Police. If pursued, penalties could amount to tens of thousands of dollars. Because of this, Deputy Labour Leader Richard Marles believes the state may need to adopt New Zealand's lockdown style. This was also said to have been discussed between Prime Minister Scott Morrison and Victoria Premier Daniel Andrews, and this would mean closure of all businesses with the exception of essential services, particularly supermarkets and chemists. It would also lead to further restrictions for residents and keeping people in their immediate neighborhoods for essential needs. Wearing of masks will be mandatory as well for regional Victorians from midnight on Sunday. The Victorian government meanwhile released a $300 Australian coronavirus hardship payment payment for those who are employed but are not entitled to sick leave in the hope this discourages people from going to work when potentially infected. More than 5,000 people have availed of the assistance. Brazilian First Lady Michelle Bolsonaro tested positive for the coronavirus on Thursday, according to the office of President Jair Bolsonaro. This comes days after her husband said he had recovered from the disease. She is in a state of good health and will follow all established protocols. The Planalto Palace, the president's official residence, said in a brief notice to the media. Meanwhile, Bolsonaro said on Thursday he had taken a blood test and was a little weak a day before. He added he has a bit of an infection and is taking antibiotics now. He also revealed after 20 days indoors he has mold in his lungs. The Brazilian president has recovered from the coronavirus infection.
I'm cured of COVID-19. I already have the antibodies without a problem. Firstly, I thank God, and then the medicine that I was given by medics. That was hydroxychloroquine. The next day I was fine. Was it from that hydroxychloroquine or not? I don't know, but it worked.
Eu não sei o que ele está tomando.
Tokyo could declare a state of emergency if the coronavirus situation in the Japanese capital deteriorates further. Its governor warned today Yuriko Koike also implored residents to follow health guidelines to contain the spread of the virus. If the situation worsens, Tokyo would have to think about issuing its own state of emergency, Governor Koike said. Koike said Tokyo had confirmed 463 new cases today, another single-day record. The Japanese government lifted the nationwide state of emergency in late May after Japan appeared to have contained the outbreak, but the virus has made a worrying resurgence. Vietnam records its first death from COVID-19 today after being lauded worldwide for one of the most successful pandemic responses to containing the novel coronavirus outbreak. Patient 428, a 70-year-old man from Ho Anh City who appears to have contracted the disease in Da Nang, died today, state media VTV reported. He had a history of hypertension, heart failure, pneumonia, and ischemia, report said. The country of 96 million had gone 100 days without infection before an unexpected cluster of new cases surfaced in the central and popular resort city of Da Nang a week ago. Vietnam's health ministry reported 45 new infections in the coastal city, marking the Southeast Asian country's biggest single-day jump in cases since the beginning of the pandemic. The newly confirmed infections in Da Nang have lifted the total number of cases in Vietnam to 509. Some experts say Vietnam could be paying for the complacency after its initial success stopping the virus, with normal service quickly resuming, face masks used less, and domestic travel activity surging. The current wave is traced to Da Nang, but the source is unclear. British Prime Minister Boris Johnson launches a new slogan for dealing with the pandemic. The new slogan is aimed at improving people's behavior during the pandemic. Hands, face, pace, get a test, he says. This follows the introduction of stay alert, control the virus, save lives. Meanwhile, he also said he will make sure there are no discharges into care homes of people who test positive for COVID-19. And those are the reasons behind the news here in Australia and in other parts of the globe. Back to you, Jago.
Thank you, Marielle, and to the rest of the UNTV News and Rescue team in Perth, Australia. Stay safe.
And those are the reasons behind the news the last day of July 2020. I am Harilyn Delgado. We serve the people. We give glory to God.
Reasons we deliver to you as they unfold. I'm Angelo Castro III. Because we need to know. We will always ask why. Have a great weekend, everyone.